Hello, and welcome to the Human Rights Campaign's World AIDS Day panel on Global Perspective on HIV/AIDS. I am Jean Friedberg, the Director of HRC's Global Partnerships Program, and we have an awesome panel today. I am very proud to introduce this stellar group of HRC partners from around the world. First, I want to introduce our extraordinary moderator, Tamara Adrian, known to so many of you. She is a Venezuelan lawyer, law professor, and human rights activist, and a defender of LGBT women and HIV/AIDS. She's the first trans woman elected to the National Parliament in Venezuela. Welcome, Tamara, and thank you for joining us today.
Thank you very much for the invitation. I'm proud to be here.
Wonderful. Then to our panelists. Akua Agyame is a queer Ghanaian activist and socio-medical researcher at the University of California in San Francisco. Her work examines the multi-level and intersectional determinants of HIV among queer men and trans populations in Africa and diaspora communities in the context of criminalization and other structural violence. Welcome, Akua. Then Diego Mora is an advocacy and communication specialist at Doctors of the World in Colombia. He is a researcher on the use of appropriate language to refer to HIV correctly and to eliminate barriers associated with stigma and discrimination. Diego is a longtime HRC partner and was a fellow with us some years ago. Welcome, Diego. Great to see you.
Thank you, Jean. Thank you for the invitation. I'm very happy to be here today.
Great. And last, but of course not least, Simran Shaikh. She identifies herself as a trans woman, a hijra, and is an advocate for the rights of transgender women, people living with HIV. She's currently the Director for Transgender Health and Accelerate at Johns Hopkins University School of Medicine. Welcome, Simran, and thanks for joining us as well.
Thank you, Jean.
And with that, we have the panel and we are ready to go with the conversation. I welcome you all today and hand over to our wonderful moderator for what I know will be a very interesting and stimulating conversation. Thank you very much, and over to you, Tamara.
Thank you, Jean, for this presentation, and of course, to the Human Rights Campaign for this initiative that it's very important in this moment of the COVID-19 pandemics. After 20 months of a very difficult time for many countries and many persons, it is now a moment to ask ourselves how the COVID-19 pandemics has affected the response to HIV/AIDS pandemics. How it has affected from the point of view of funding, how it has affected it from the point of view of root grass reaction, organization of communities, and even we should ask ourselves if in view of these current pandemics, the HIV pandemics is not becoming a forgotten pandemics, and how to revive it. I think all these questions are to be addressed, are to be responded in this panel. And I will start by continents, asking about how the HIV/AIDS epidemics has been affected in your region, in your country, in the past 20 months by the COVID-19 pandemics. And I will ask this question first to Diego Mora Bello for what is happening in America, in Latin America.
Thank you, Tamara. It's a pleasure to me to be here today, I say to Jean, and thank you for the invitation. I want to talk first about the context in Latin America in HIV. More than 2 million people live with the virus in the region, and more than 30,000 die each year. The number of infections of HIV in Latin America and the Caribbean increased by 21% from 2010 to 2019. The stigma that still exists around HIV and AIDS, as well as unequal access to health service, also impedes the progress towards eliminating the infection. Since the start of the pandemic, the number of people who have been tested for HIV infection has dropped dramatically in both in the Caribbean and in Latin America. For example, in the first half of 2020, approximately 4,000 fewer diagnoses of HIV infection were made than in the first 6 months of 2019, especially in 8 countries in Latin America and the Caribbean: Guatemala, Guyana, Haiti, Honduras, Jamaica, Peru, Dominican Republic, and St. Lucia. People with a diagnosis of HIV infection do not have access to antiretroviral treatment, so they run the risk of losing their lives and may continue to expose others to the infection. No? I can say only 2 points about the context on the HIV in Latin America. The percentage of children born with HIV has fallen from 20% in 2010 to 50% in 2019. And the other point is the percentage of people with HIV in treatment increased from 43% in 2010 to 60% in 2019, but it's still far from the 95 targets of UNAIDS. No, I think the pandemic was a very strong barrier for the people, not only for the people living in Latin America. Latin America now is a region that have a lot of migration, and the migration don't have access to health service, don't have access to treatment, and don't have access to prevention. And it's very sad that we need talk about this, especially because the international cooperation is working in this issue, but the governments, the states don't have the power for face this moment, no?
Wow, that's a compelling overview of the situation in Latin America. And unfortunately, AIDS epidemics started in Africa. And it is important now to understand what is happening in Africa. And I will ask Akua to tell us a little bit about these issues in Africa.
So much, Tamara. So, as you know, Africa is the region most burdened by HIV. And I want to discuss it in terms of the regions because there are significant differences depending on what part of the continent you're in. And so I'll start with East and Southern Africa, which bears the highest HIV burden in the world, with an overall prevalence of 6.7%. And that represents about 20.7 million people living with HIV. The region, I think, relative to West and Central Africa is closer to reaching the previous goals, the 90-90 goals set by UNAIDS. About 87% of people are aware of their status, 83% of those folks are on treatment, and about 90% of those on treatment are virally suppressed. So there's been advancement in that area over the past decade. But I think there's significant challenges exist for key populations, that is populations that are at greater risk for HIV, usually due to structural or the social factors that shape risk, such as criminalization and stigma, etc. So key populations include sex workers, gay, bisexual, and other men who have sex with men, people who inject drugs, trans women, and prisoners. So for those, excuse me, for those populations, about half of sex workers have HIV. About 20% of men who have sex with men have HIV, and the prevalence among people who inject drugs is 30%. So you see a significant disparity between the general population and more key populations. And for trans women on the continent, there has been, unfortunately, not enough research looking at the epidemic amongst the population. So they're actually just emerging data now over the past few years on kind of reporting a national representative prevalence in different countries. But a polled study from 2017 showed that about 25%, the prevalence among trans women is 25%. So this is definitely an area of need in terms of research. And I hope that over the next few years, we can actually make advancement in that for such I think it's a huge injustice that a population that is so marginalized has not received as much attention and resources in the epidemic. In Western Central Africa, there is a mixed epidemic, that of low prevalence, a low prevalence epidemic. About 1.4% of the general population has HIV, representing about 5 million people. And there's a gap, there's a bigger gap in this region. I think it has to do with, because HIV is not as prevalent, there's more stigma, if that makes sense, because it's not, in some ways, I think it becomes more normalized when there's a greater prevalence than in regions where there are lower prevalence. And so about 51% of people with HIV, 64% of people with HIV are aware of their status. 79% of those people are on treatment, and 76% of those on treatment are very suppressed. So again, the same kind of disparities exist for key populations. Prevalence among sex workers ranges from 4% to 30%, and among MSM it is 13.7, almost 14% of men who have sex with men are positive. So I just want to say that I'm, just briefly on COVID. COVID, of course, has impacted Africa, especially Southern Africa, South Africa in particular. And while in South Africa, people were able to be initiated on ARV, get tested, initiated in HIV on ARVs, it was still heavily impacted by COVID. And countries such as Nigeria and Kenya, up to 50% of those who are living with HIV could not get their ARVs. I think more data is emerging on the specificities of the impact of COVID. But, given the scale of the epidemic on the continent and the, health systems challenges, I think we will learn over the next few years the impact of COVID, the full extent of the impact of COVID on HIV. But I just want to say one thing in terms of context, just to add context before I turn it back to you, Tamara. The disparities I discussed, particularly among queer men and trans women, is really important to highlight on the continent, especially the disproportionate impact of HIV among queer men and trans women has really been a product of multiple social structural factors, such as criminalization and stigma, and also historic factors that I think we need to talk more about. In the history of the epidemic, there was a historic exclusion of gender and sexual minorities from HIV policies in the global South. I think other speakers can talk about that. The epidemic in the West was described as a primarily, homosexual epidemic. And in the global south, it was described as predominantly heterosexual. And funding and policy priorities kind of flowed from that characterization, leading to, for lack of a better word, a blind spot in policies and a gap in funding for queer and trans people in Africa. And the impact of this, I think, has yet to be studied. Like, how many people died as a product of this construction of the African epidemic as heterosexual, has led to, thousands and thousands of people dying as a product of a lack of programs and funding to address the epidemic there. There's a number of different factors that led to that, but I think a criminalization of same-sex sexualities is a big part of it, and also a lot of ignorance by Western funders around African sexualities really informed this blind spot. But what has been happening the past decade is a catch-up due to this, multiple decades of excluding queer and trans people from HIV programming. So I just want to make that note before kind of throwing it back to you, Tamara. Thank you.
Well, thank you very much, Akua, for that reminder about the exclusion of sexual minorities from public policies addressing HIV epidemics in Africa and some countries, and how founders have neglected to do their job in including everyone. I think that must be addressed. I even remember a case in which I was talking to a politician, African politician, and he said something like, but that doesn't exist in Africa. There are no trans people in Africa. There are no gay people in Africa. So the ignorance is so huge that sometimes it has to be addressed with education and via public policies. And I address now the same questions to Simran Barusha, that it's located in a subcontinent in itself. And she has a very difficult task because India in itself is just as different as it might be from other countries in the region. But I will ask her how the HIV/AIDS epidemics has been impacted by COVID epidemics.
Thank you so much, Tamara. I completely echo your statement while you said, yes, India is a mini continent. And when we talk about the HIV and the AIDS scenario, let me take you to the Asia Pacific. A few anecdotals that we have from the Asia and Pacific, and this is being in the public domain, and this data you could find it of 2019. So I just wanted to read the statement from there. The Asia and the Pacific region on the globe has around 5.8 million people who are living with HIV. Every year, we have around 300,000 new HIV infection cases within this region. And around 160,000 HIV and AIDS related deaths we have in this region. Now, this was the Asia Pacific scenario. Let me come to the mini continent called India. As it is written, we should not be proud of it, but this is the reality and the fact that India has the third largest HIV pandemic in the globe. While we talk about the figures, in India, we have around 1.2 million people who are living with HIV currently. When we talk about every year, we have around 88,000 new HIV infections. Though, I mean, we we should mention that, India is progressing in towards the HIV. If you compare from past few years or decades, if we compare from 2001 onwards, India has reduced its new infection cases by 50%. Yet, we have around 88,000 cases every year, which are identified. However, the COVID pandemic is no difference from what my colleagues have mentioned from Latin American or from the African region, what they mentioned. I think COVID pandemic has globally impacted the overall HIV scenario. There have been thousands and thousands of people who are living with HIV were unable to access ARV medications during the start of the pandemic. Some of the countries really did enough to ensure that during the lockdowns of the countries, at least the ARV medications were home delivered to the people who were living with HIV. And India is one of them. There has been progressive steps which were taken for people with living with HIV, but overall saying that HIV did impact every human being who was living with HIV. And these are few challenges which has been, if you see the two years graph, Tamara, you will see that, this COVID and HIV related webinars, conferences, donor meetings have taken the highest number of webinars, Zoom calls and meetings and everything virtual happening. It has been repetitive now that activists or people who have been continuously talking that yes, COVID has impacted. It's high time that we really do something, and this COVID has given us an eye-opening for many such kind of pandemics, which we hope never comes to this world, but you never know that it would also come. And this is a preparatory towards, ensuring proper measures are being taken. I think that's one of the best learnings that I think the globe has taken from the COVID pandemic. I do not wish to have any more pandemics coming to this globe, but this is an eye-opener which has made us alert. And the challenges are nothing different from any part of this globe. The challenges which have been faced in maybe the US is the same in the global South, and everybody has faced the same challenges. So here I really wanted to mention about this. Over to you, Tamara.
Well, thank you very much. I guess that the situation, it's mostly the same all around the world in this moment, in this global South. And it is for certain that the COVID-19 epidemics has impacted the reaction in the policies concerning HIV epidemic. And I would like to start with Akua, the second question. It will be now addressed to your country of origin. Which are the challenges and progress, particularly in your country in the past years, and what might be foreseeable as an outcome from this situation you will describe?
So the kind of the situation in my region, my country in terms of HIV. Yeah, so in Ghana, the prevalence is relatively low, right? There's a prevalence of 1.7% among the general population. But kind of similar to what I described in Western and Central Africa, there's a mixed epidemic and a significant crisis facing key populations in Ghana. Men who have sex with men comprise of kind of have the highest HIV prevalence with 18%. In the capital, a recent study found that it was 42% of queer men who were HIV positive. So this has increased from 34%, the last surveillance study that was done about 8 years ago. And so there's something happening here. I think it's a combination of increased efforts. However, the increase in prevalence might also point to an increase in infection, HIV infection. And I think more data is needed to pinpoint what's driving that increase in prevalence. If more people are actually just now testing, or if there's also, it's that combined with expansion of the epidemic among MSM. But that is, a key issue facing Ghana right now. The disparity between key populations and the general population. For sex workers, the prevalence is lower, but still significantly higher than the general population. And underlying this context is the legal issues such as criminalization of sex work and criminalization of same-sex sexualities. So Simran might be able to speak to this. Ghana is a former British colony, and many former British colonies were surveilled and regulated. Local sexualities were surveilled and regulated through an unnatural carnal knowledge law. It's not exactly an anti-sodomy law, but sodomy is one of the things that is described as unnatural within this law. And post-colonialism, our new government still maintained these laws, and they have had a significant impact on queer and trans populations in these respective countries. In Ghana, this is still law on the books. And I want to talk a little bit about how it impacts HIV kind of outcomes among queer and trans populations, and also efforts by religious groups to further criminalize LGBTQ people in Ghana. I want to use this opportunity to talk about it because this is an ongoing fight in Ghana that I think is important to raise awareness around. So the Global Commission on HIV and the Law has released studies on this, that criminalization negatively impacts HIV in terms of access to testing and counseling, access to treatment. There are different levels of criminalization, of course, laws that criminalize aspects of being a person living with HIV. There are also laws that criminalize populations that are at higher risk of HIV, laws that drive the epidemic among those populations, and in Ghana and in many parts of Africa, where it is still criminalized. LGBTQ identities are criminalized. There are about 31 countries in Africa where it is illegal to be LGBTQ. In Ghana, recently, as recent as July, a coalition of religious groups, predominantly Christian religious groups, but also some Muslim groups as well, and traditional leaders have come together and lobbied the government with a new law proposed bill that aims to further criminalize LGBTQ identities. And it's really scary, the prospect of this bill passing. So just to give you a summary of the bill, I'm just pulling it up. So the bill is titled "The Promotion of Proper Human and Sexual Rights and Ghanaian Family Values." And the bill was introduced just 2 years after the coalition that introduced it partnered with the religious right-wing hate group called the World Congress of Family. This is a US-based right-wing hate group. They partnered with them 2 years ago to host a conference in Ghana, and 2 years later, we see the introduction of this proposed bill in Ghana. So this bill, just to give you a summary of what it aims to do, if passed, it would require Ghanaians to report suspected LGBTQI persons to the police or face 4 months in prison. Suspected LGBTQI people would be required to undergo conversion therapy or face up to 5 years in prison. Intersex people would be subjected to forced medical intervention, but of course they want to regulate whether trans people can choose to do gender affirmation surgeries, but intersex people would be forced to do it. And so you see a lot of the hypocrisy at the heart of this kind of regulation. Activists and allies for LGBTQI rights would face an even harsher punishment of up to 10 years in prison. And the bill would also call for the immediate disbandment of LGBTQI organizations. Knowing that much of HIV programming for queer men and trans people are actually driven and by LGBTQI organizations, the potential kind of impact of this on HIV is really cannot be understated. So, disbandment of organizations means a disbandment of HIV programs. Regulation of what do you call it? Programs. The bill would basically jeopardize HIV programming that the government is engaged in, that NGOs are engaged in. The duty to report clause of the bill would mean people would be scared to seek services if they're assumed to be LGBTQ. Just the list of potential dangers and the violence that LGBTQI people would face under this law is endless. So I just wanted to use this opportunity to raise awareness about this bill. This is the third major bill in Africa that seeks to further criminalize LGBTQI people. Uganda kind of made the news about a decade ago when it introduced and eventually passed its own bill, dubbed the Kill the Gays bill. Nigeria in 2014 passed the anti-same-sex marriage bill that basically criminalizes, kind of has similar clauses as the one I just read from Ghana. And now we're seeing Ghana do similar thing. This criminalization, the violence that it will generate, we're already seeing like viral videos of people being attacked by mobs in Ghana. And earlier this year, about 21 activists were arrested and jailed for weeks with no real charge. We know that this will only get worse if this bill is to pass. So that's kind of the context in my country right now. And activists are just organizing to raise awareness about it. Activists who are also engaged in and have historically been involved in HIV work among key populations are leading this work. And I hope that we can kind of learn more about this and see ways that we can advocate against this bill. So sorry for the going on.
Yeah. No, it was a very important remark, and it is scary how the far right wing and fundamentalist churches from the United States are impacting globally the fight against HIV/AIDS epidemics, because they are trying to erase from the planet LGBTQI people by means of criminalization or by means of denying even the existence of LGBTQI people. And I guess that the fight for or against criminal laws in India has been a long, very long way towards equality. And I would like Simran to speak also a little bit about the progresses and the challenges regarding equality and how that impacts HIV AIDS.
Thank you so much, Tamara. Yes, as you correctly mentioned, India has progressed. India has turned the tables around. We are no more criminal. And I, as a proud trans woman, as an Indian citizen, am no more a criminal individual in my country. These tables were turned around in the year of 2018. So legally, I got my freedom 4 years back. Though my country is going to celebrate, it's celebrating its 75 years of its independence, but we consider as the entire LGBTQIA population, individuals are been celebrating their independence past 4 years. Speaking about the legal situation right now as India for the LGBT folks, and also for the people who are living with HIV. I would turn my table around the HIV perspective first and give you an insight that it was never a criminalization or never a criminal act if a person was living in India as a person who is openly living with HIV. It was never a criminal offense. However, by saying this, there was a very, very tremendous mindset among the masses that HIV came to this country through homosexuality, through homosex, which was incorrect, actually. Of course, the prevalence was high within the homosexuality, but it never invaded India through homosexual sex. Of course, it was later on proven, and a lot of debates have happened around that. By saying this, also we all know that during 1986, the first case ever was identified within the country in down south. That is the first HIV case was identified. And since then, it's almost been now 3 decades that India has progressed. You talk about the HIV Acts, the HIV Act, which was introduced in the parliament to ensure confidentiality, to ensure there is no stigma or discrimination happening to any individual who is living with HIV. At least there's something in the books of law. Now, how much that is implemented, that's a big question mark, because again, I would like to go back and tell everyone who is really watching this that India is a mini continent. So having things really coming down at the grassroots level do take time. But we do have in our books of laws, we do have HIV Act, which is mentioned, that does not discriminate. It does not hold you responsible, and you don't have to be open and out. It holds your confidentiality. It integrates your confidentiality. It also integrates your grievances if a person who's living with HIV faces. Now, coming to the criminalization part, Tamara, the criminalization, as I mentioned, we are now a legal citizen. We are now an independent. We are recognized, including transgenders, have been recognized by the highest court of this country, saying that we are now third gender. So you don't have to hide your identity, or you are not blamed to change your body or your gender, which was assigned to you during your birth. However, by saying this, it has been taken years. Progresses are being made. We are sort of progressing. I mean, the tables are changing. The sides of the tables are changing, but it's going to take a longer period. Right now, within the country that we are dealing is not with the law, but with the mindsets of human beings. Because there is a mindset of human beings which sort of says that, homosexuality or LGBT folks should not get the permission to get married. So which means the same-sex marriage is not permitted in India. The adoption rights of homosexual people or a transgender individual is not permitted. And there are so many other laws which really restricts. But I'm sure that the major gate has opened in 2018. I'm definitely sure that these smaller gates will also open over a period of time. And I hope before I close my eyes and I say goodbye to this beautiful world, I do see all the gates being opened. Over to you, Tamara.
That was a compelling last sentence. I guess I was moved by it. And I will ask the same question to Diego. He's located in Colombia, and I would like to know how the fight against epidemics has progress or recede in your country and the challenges you're facing now.
Thank you. First, I want to say that I agree with Simran that the response to HIV have a global challenges is real. I understand that the situation is very different from continent to continent. Maybe the situation for LGBT people in Africa or India no is the same in Latin America. In some countries, in others, yes, of course. But we have a different realities, but the challenges is a common for all. No? I want to say that the challenges in Latin America or in Colombia are divided right now in different parts. We have not only the impact of the COVID-19 pandemic, we are also experiencing a time of high migratory flow. And I remember we have a lot of migrants now in Latin America, not only from Venezuela. Now we have the presence of intercontinental migrants, finding people from Nepal, from Bangladesh, from Senegal, and different countries in Asia, Africa, and even Europe. Colombia specifically has become a mandatory step for migrants on their way to the south of America or Central or North America. These people, apart from suffering discomfort from long walks, because all the time is walking, have to continue with their diagnosis, often without medical attention and without treatment. No? And this situation is very special because the states don't make part of the response of the HIV for that, or for them. International NGOs, such as Doctor of the World, where I work in, are helping migrants to have access to prevention and diagnosis methods. And in some cases, those who will remain in the country are referred to as treatment through legal channels, no, with another organizations that work in this issue. But this is the small reality because the truth is that the vast majority of migrants don't have access to sexual and reproductive health service and continue during their journeys having unprotected sex with increase of the risk of infection of HIV and other STIs. And in some cases, the presence of the state is almost null in this sense, not only here, I think in different places with the presence of migrants. And I want to put the view in this issue because it's very important, not only for Latin America, it's very important for different continents about the migration. Maybe in Colombia, we have the possibility when you have your diagnosis, if you want, you can go to take the treatment. But the migrants, no. The migrants don't have access to health service, don't have access to treatment, don't have access to prevention. And I think is the big challenge now. If we receive migrants for different countries, we need open we are our health service for all the people. And I know I will say that this is only the point of the big problem, because the challenges are a lot, but the view for all now in Colombia, or for our organization, is war for migrant people. No.
Thank you very much, Diego. We are now about 45 minutes in this seminar, and I would like to ask you final question before the final remarks. It's a complex question. I mean, I will ask you, how involved are the communities in this moment in the fight against HIV/AIDS pandemics? How to involve them better and much more enrooted? And how do you foresee this involvement of community might help to end the HIV/AIDS epidemic? And I will start because within the order, I will start in this case by Simran.
Thank you so much, Tamara. And this is completely my purview, and this is what I believe after, being for so many years, being as an advocate, being as an person who is traveling through this journey. And as I mentioned during my, as Jean mentioned during my introduction, that she identifies herself as Hijra, which is a subsect of a transgender umbrella term. Answering to your question, honestly, I think over the years, we have seen many global conferences which have indicate as various population group, or what we call as at high risk group representatives, demanding and ensuring only one statement: nothing for us without us. I think that statement has struck very clear to all the possible donors of this world, all the possible investors who really genuinely care to end the HIV epidemic and have now slowly started ensuring that key population representatives are equally present during just not discussion, but also the designing of an implementation of any HIV/AIDS program. I think I'm really super proud by coming from India. India has always ensured, of late, India has always ensured that the community is at the driving seat and not at the passenger seat. And by doing so, the interventions together are being designed by the community, for the community, to ensure that we eliminate any new infections within the country. I think that step really has progressed in India, and that is making everyone accountable. We do understand that this is a mini continent. We have a lot of variety of diverse cultures and individuals, and around 3,000 languages being spoken within this country. With all those things, I think India has made progress, has ensured that representatives from district to states to national level are all synced and representatives of community are present. It could be from people who are injecting drugs to people who are into sex work, to people who are into same-sex relationship, or let it be a trans woman. I think all representatives are there. And that's only the way that we can, together fight this pandemic and ensure that we one day succeed this. Also, by ending the statement, that's my dream, that before I close my eyes, I wish to see that no new infections within this country. Over to you, Tamara.
Wow, thank you very much. That's our dream. And I was thinking about how involved is the community in Colombia and in Latin America in general in this fight against HIV? How can you improve also the involvement of the communities in Latin America? And that is, of course, addressed to Diego.
Thank you. I will take a point very same to Simran when she say all with us, without all. Again.
Nothing without us for us.
Yes, thank you. Because I think the people don't need representation. The people need tools to be part of the participation, and it's in the same way, where they can have a voice and vote and ensure the rights and access to health service, friendly health service that know how to treat the person with HIV without the stigma, without signs, without discrimination. Health service that builds society, equality, and respect. No continue the issues that the people living with HIV live for 30 or 40 years with a lot of very bad words, a lot of bad attention, a lot of bad movement against them. I say no more. They don't need this thing. These communities are the ones that live directly, not only the infection, but also all the processes of access to diagnosis and treatment. So having that the first-hand information in the response will be of great support for the generation of public policies that benefit and improve the quality of life. Now, the HIV epidemic is not just centralized in men who have sex with other men, or transgender people, or rejecting drug users. We now have a lot of other populations that deserve special attention to the response. Now we have older people with 30 years of treatment, and they need a special attention, different attention. They don't need the same attention. Migrants, I say, and I repeat all the time, migrants go become a large population in constant movement, which creates more challenges for care, for treatment, and more important for adherence of the treatment. And we must include other communities, especially in Latin America, such as indigenous people. They don't have visibility about HIV and AIDS issues. Never participate in the conference or in the response, or I don't remember, say, see indigenous people in this work. And the message from Latin America, from Colombia, is we need to include all the populations, all the communities. No is the word only for transgender people, for the men that have sex with other men. No, this is a problem for all the people. Now we need to include the populations that don't have participation in the movement, but more in the decision. I think is the way for a better response to HIV and AIDS.
Thank you, Diego. And in the same line of this question, Akua, what do you think about the involvement of the communities in Africa, and how to improve their participation in this context of fighting against the epidemics?
Yeah, thank you. I think that's a really important question, and I really want to echo what Diego and Simran have shared so far. There is no eradicating HIV without the most affected communities leading this work. And in fact, the progress that we have seen over the decades is in large part because of the advocacy and labor of community organizations, of activist groups. We would not be here without their sacrifices and their courage in pushing for destigmatization of HIV, and pushing for funding, and pushing governments to make sure that they are not pushed into the shadows. So, 40 years into the epidemic, I think we really need to center this question: how do we actually meaningfully, and I think Diego, you were talking about this, meaningfully involve community groups? Because there's a lot of symbolic things that happen, a lot of committees that people can, sometimes people have even been flown to conferences, but meaningfully, how are community groups being invested in? What leadership structures and roles exist for community groups to take up, and what does it look like when that representation finally happens, right? Our folks in my work in Ghana, what I have found is that, when key population organizations are involved and given a seat at the table, it is very shallow. People are silenced. People are afraid to say what is actually happening on the ground because they fear losing funding. People have to sit there and listen to stigmatizing commentary about risk in their communities. I mean, I can't tell you how many times I've heard, queer men be depicted as some kind of, what do you call it? Depicted as praise, basically, of youth, and that the HIV work that the government is doing is to warn youth of the harms of homosexuality. And I'm not just making this up. This is a literal quote from the director, the former director of the Ghana AIDS Commission, where she said, quote unquote, in response to a backlash, this was in 2011, a major news publisher published an article saying 8,000 homosexuals found in the western and central region of Ghana, most have HIV. Of course, all that data was inaccurate, but it didn't matter. The damage had already been done. And there was a major backlash that lasted for the rest of the year. Organizations had to go underground. Peer educators were threatened with death. Arson, threats against offices, etc. And in response to this backlash, what did the Ghana AIDS Commission director at the time say? She said that their programs, because now the programs were public, the public knew about the HIV work that was happening. They said the programs aim to educate males about, quote, the dangers of being involved in sex with other men, and that it is important that all hands are on deck to reduce the number of young people who are lured into MSM. This is the director of the national response to HIV. And unfortunately, this still persists. In the bill that I referenced in my previous comment, one of the most sinister aspects of it is that it is using HIV data to justify the criminalization of LGBTQ people. And it is sickening that this kind of this stigma and this violence persists decades into the epidemic. I think ensuring that community organizations are at the heart of this work will help us address this stigma, these stereotypes, and to say, you know what, we shouldn't have to shy away from the fact that, prevalence is disproportionately higher. It is higher because of criminalization. It is higher because of ideas like these. It is higher because people are afraid to go seek services, are afraid to go buy condoms, are afraid to go get treatment, and many people are dying. That is the crisis that needs to be addressed rather than the ridiculousness of proposed bills like this that aim to eradicate LGBTQ people. So I just want to say that, this work is, driven by community organizations, but they're not invested in. I can't say how many times conversations I've gotten into with peer educators who are literally volunteers. Peer educators are driving the work on the ground and are not getting paid. This is an issue of exploitation. Peer educators, sex worker peer educators, trans peer educators, queer peer educators are leading this work and are not getting paid for it. This is unacceptable. We need to change the political economy of how HIV funding works, who's being invested in. There are lots of big organizations, both local kind of implementing partners and international agencies that get funding, and that funding does not make it to the most grassroots groups. People are dedicating a lot of time doing this work. Activists are dedicating a lot of time doing this work, and they're living off of stipends, that are not actually livable wages. So I just want to say that, there needs to be different levels of investment in terms of leadership, funding, and really supporting the community groups that are at the front lines of this work. So, yeah.
Thank you, Akua. And we are almost finishing this panel, and I would like you to make a list of wishes for the end of the year, address to the governments, address to the founders, address to whoever you want to address this list, and of course, to have your final comments in this panel. I will ask Diego to start this comments and this wish list.
Thank you, Tamara. I want to take a point about how we can help the response to HIV. And I want to say, all of us can support. We are all political agents of change, and that is why from our homes, from our jobs, we can carry out actions that respond to HIV. In my case, for example, I want to talk about my work. I work every day so the journalists, the media, but in general, the society have the necessary information to make proper use of language about HIV. And in this issue, we can eliminate the barriers generated by stigma and discrimination. I worked for the last 5 years in the research and recognition of the use of language related to HIV and AIDS by the media in Latin America, Caribbean, and Spain. And although there's has been a change in these years, there is still much to do so that journalists have knowledge of the proper use of language, which is also just keeping in mind a few words. For example, do not say contagious, say transmission. Not say disease, say infection. Or do not talk about HIV and AIDS as if we are the same. Make reference to STIs, not to STDs. This type of inappropriate language becomes barrier to access due to stigma and discrimination. Other people, we do from their search for policies that can respond to the epidemic and benefit access to prevention, diagnosis, and treatment. And thus, each person has the power to support the response. No matter the action, the important thing is that community work can achieve benefits for people with HIV.
Thank you very much. Akua, what is your list of wishes? Are you there? I think she is frozen. Let's go to Simran then.
Sure, Tamara. Thank you so much. I think my wish list is one. I mean, it's just one, but I have a message. So I will start with a message and then come to my wish list. And my message is something which is not copied from Google. but it's straight from my heart to whoever is watching this. I think the fight is still not over. The fight is still not over, and we need your support, your generous support to ensure that we fight together to end this epidemic. That's my one message to all and everyone. And my wish list is, I know I'm really very, very sort of an optimistic person on this planet. I wish that next year we don't observe World AIDS Day, but we celebrate to all the activists who have tirelessly fought to ensure that, you know, we eliminate HIV. That's my wish list. Over to you, Tamara.
Thank you very much. I think, I don't know if Akua has came back to the panel. She had a technical inconvenience. But then I want to thank you for being here. Oh, she's here. Oh, Akua, thanks God, good. Can you make your final remarks?
My apologies. Of course, my computer froze right when we were ending. So I just called on my iPad. My apologies for that. I think that, you know, a final remark is that, you know, HIV is a disease of the body like other diseases, but it is also a social disease. And as such, we have to address the structural and social drivers of the epidemic. We've talked a lot about criminalization and of stigma. And I really think also of funding and also of racism, right? Racism, imperialism, ableism, you know, patriarchy and homophobia and transphobia is driving this epidemic. And we have no hope of making a dent in it if we do not address these issues structurally, not just in symbolic ways, as you know we previously talked about. So I think my comment for this World AIDS Day is that we cannot afford to not address these structural issues. There are organizations who have been raising awareness of it for years and organizing against it. And I think we have to continue. We cannot have this epidemic be dependent on, you know, different, every time a new government comes in, we have to start over again. You know, we witnessed this in the US with our own previous government. You know, it's just, we cannot make the epidemic dependent on like fluctuating political situations. We have to be consistent. We have to address the issues that are at the heart of it: the stigma, the criminalization, the racism, you know, the global inequities, etc. So that is the fight in front of us. And if we can continue to highlight those issues, then I think it will be harder for those who have a different agenda, those who are not committed to a more just world. It will make it harder for them to put us in the shadows. So yeah, let's keep fighting these, not just HIV, but all the ills that drive it. Thank you.
Thank you very much, Diego, Simran, and Akua, for having been so insightful, so accurate with your comments, and so inspirational. And thank you, of course, to Human Rights Campaign for having organized this meeting in this important day. Let's not forget that HIV/AIDS epidemics is an ongoing epidemic in the world, and we cannot forget this epidemics by centering our attention in the current pandemics. Thank you very much again for your presence here, and I hope that you will be motivated to participate in this fight, that it's a fight for everyone and a fight for a better world. Thank you again. Goodbye.
Well, thank you, everyone. That was an amazing panel. We really appreciate this amazing conversation. And as our panelists mentioned, this is an opportunity for all of us to participate and really continue this conversation. We are far from over from reaching our goals. So if you'd like to learn more about what HRC is doing, please visit www.mybodymyhealth.org for information on what we're doing and to learn more about how you can be involved. Thank you so much again to all of our panelists.